Hi, I'm Tracy Spiegelman. I'm the clinical coordinator at Eastern Kentucky University, and this is a little slide presentation to let you know all of the things that you need to know as a preceptor working with our students at EKU. First off, there's a few items that I need every year. These are CATIE requirements, and we need them in order to keep our accreditation. I try to make sure that I get them every year so that I don't have to run and chase them when we finally get to an accreditation year. So here they are. I need a copy of your emergency action plan if it has been revised. If you get a new preceptor or the plans change, the gates have changed at your school, that would warrant an update of your emergency action plan. When you do that, I'm asking that you please send me the updated version. Second, I need a copy of your annual modality inspection report. And third, I need a copy of your CV and/or resume if it's changed over the years. So you know, sometimes we do assign this as a class assignment. We ask the students to collect EAPs, annual modality reports, so that we have them here. We also use this as a double check to make sure that the students are aware of emergency action plans at your clinical site. So the emergency action plan, as I said, it does need to be reviewed with the student when they get there, and it should be easily accessible. And if I was to ask your student whether you go over the emergency action plan or if they know what it is, they should be able to tell me what it is and how it operates and what their role is if there is an emergency. Another piece of information that we need is the bloodborne pathogen exposure plan. And this is the OSHA rules and guidelines for your athletic training room. So bloodborne pathogens, where they go, is there a red wastebasket, wearing gloves. Almost every school has one of these somewhere. The student needs to know what it is and where to find it. In addition, I talked about the modality inspection report. I do need this every year. I do know that each school does it at different times throughout the year, and that's totally fine. But I do need a copy of it each year to ensure that your modalities are all calibrated and up to date. One of the questions is what is included as a modality, and believe it or not, ice machines, refrigerators, tables, in addition to your traditional modalities, electrical stimulation and ultrasound units, all need to be calibrated. So and checked regularly. So that's what needs to come to me. So at the current moment, we are phasing out our Bachelor's of Science in Athletic Training program. We have one class left. They're all seniors right now. And we currently are in our third cohort of the master's students. The master's students started in May of 2016. Some of you might already had master students at your clinical sites and some may not have, but you also may have both students, masters and undergrad, at your clinical sites. Let's focus on the master students, as the bachelor students have taken all of the coursework by the time they have gotten to you this year. The master students begin in May, and in May, they complete taping, palpation anatomy, general medical conditions, and their first clinical rotation. In their fall semester, they take upper extremity and lower extremity evaluation courses at the same time. In addition, they do 20 to 25 hours of clinical rotations. In the spring semester of their first year, the master students take their thorax or rehab class and their modalities class, in addition to their 20 to 25 hours of clinicals. In the second year, our master students have actually completed all of their core classes, and then they complete 2 full immersion clinical rotations. The clinical rotation in the fall begins in August and goes till December, so it's a full semester of full immersion clinical rotation. Their second semester of clinical rotations goes from January 18th until May 12th, or whenever graduation is at EKU. So this is just a picture of our course curriculum. So having master's students is a little different. The master's students come in, they have already completed 4 years of a bachelor's degree, and the characteristics that you should see in a master's student are they should be a little bit more big picture, they are a little more mature. Mostly we've seen that they really want to learn, so they tend to be a little bit more vocal and ask some more probing questions. And usually they're less afraid to try skills. So out at clinical sites, you should see them a little bit more assertive with patients. So what are the clinical responsibilities we have? So the goals of our clinical sites pretty much still follow the traditional CATIE guidelines. We want our students to see and experience both men's and women's sports, team and individual sports, equipment-intensive sports, in addition to seeing a non-sport population and a non-orthopedic population. And the idea of this is to help our athletic trainers really understand what it would be like to work in reality, not just in a simulated environment. So preceptors, what are your jobs as preceptors? So basically, let me break this down. We want you to model good athletic training practices. So perform complete evaluations on and off the field, demonstrate what real life management is in the athletic training room, and keep your SOAP notes. So for instance, if you have an athlete who goes down on the field and you run out to the field, perform the evaluation as you would at your site. Allow the student to run out with you. Allow the student to ask questions if the situation warrants. And then demonstrate how you follow up with that athlete and how you keep notes and things like that. The second part of being a preceptor is a track. So we ask you to approve our students' hours to help with their knowledge, skills, and abilities, which traditionally are what we would consider checkoffs, checkoffs of proficiencies of skills, and then also to evaluate our students in the middle of the semester and at the end of the year. Your impact on the students is huge because, in all honesty, the students really look up to their preceptors. You're the good guys. You're the ones that they want to be when they grow up. You are working in the field. They get to practice what they're learning. It's hands-on. It's exciting. So be yourself and be excited about athletic training. Have a purpose. Give an accurate representation of the field. Let them understand if some days you're tired and some days you're not. Communicate with your students and let them talk to you about their aspects of their life and things like that. It's okay to let them know that on occasion you get tired. You work many, many hours, and that is an accurate representation of the field. Our students are, until they get to their full immersions, 20 to 25 hours a week, and you all know that athletic trainers work way more than 20 to 25 hours a week. So don't be afraid to explain how that works and talk about what you do. What I like to see from the preceptors, so sort of my expectations of your preceptors is to set expectations with the students the first day. If you want them to be there at 3:30, tell them they need to be there at 3:30. If you want them to greet everyone who walks into the athletic training facility and say, "Hi, my name is so-and-so, how can I help you today?" Let them know that that is what you expect and that's their job. Push the students to learn. So students will have a tendency to say things like, well, we never learned this. I'm sure they learned it in their class. However, sometimes they're a little nervous, so make a deal with them. Say, I will show you this the first day, but after that, you're on your own. There's never anything wrong with demonstrating the first time. And then be positive. This particular generation of students likes you to be positive. So I'm a big fan of the Oreo cookie compliment. Great job taking the initiative to do this ACL evaluation. When you perform a Lockman's test, make sure you put your hands closer to the joint line. I'm really proud of you for going out and trying this. So that's a good example of an Oreo cookie compliment. Another thing is to provide constructive feedback to the students. They like to know how to get better if they are doing an evaluation or they're taking a history. Sometimes it's good to stand back. I always think about, when I was learning to drive a car, and when my parents were in the car, I just couldn't drive. But then as soon as they went away, I could drive perfectly. So I think sometimes it's helpful as the preceptor to stand back a little bit and let the student have the autonomy to be the athletic trainer without feeling stressed out or nervous. So those are some of the things I hope to see from you. So you can also ask the student if they perform an evaluation, how's another way to try that we can do this evaluation? Okay. So here's some teaching strategies that we're trying to use in the classroom for the students that come to us in 2016 and in the future. This is our generation, the millennials. By trade and by characteristics, the millennials are hands-on and group-oriented. They like to work together. They like to be involved, and they like to feel important. They like to feel like what they're doing is going to make a difference or be noticed. So how do we engage them? We get them involved. We ask them questions. We kindly ask them to do an evaluation. We use a little reciprocal learning. Oh, I didn't know how to do that. Can you show me? Don't be afraid to teach concepts that students haven't learned in class before. And take advantage of the generation gap. Don't be afraid to say, oh, well, you learned this new piece of research in class, tell me about it. And then I will tell you about how I do this evaluation. So, engage your students. They like to feel respected. So, take advantage of the fact that maybe the students are learning some of the new up-to-date research that you haven't gotten a chance to read because you're working 80 hours on the field. Let them tell you things, quiz them, ask them what they're learning in class, okay? The other thing that works really well with these students is to provide timely feedback. They want to know if they're doing okay, and they usually want to know if they're doing okay sooner rather than later. I have told them, however, that athletic training is a field that requires thick skin, and sometimes no news is good news. So they are prepared for that. So some of the cool projects that have been done over the years to involve the students. When Kyle Sutton was at Dunbar High School, he's now at Transy, he had one of our students revise Dunbar's EAP. That was pretty cool. You can assign 1 or 2 students to do a full rehab. We've had the students at EKU be assigned to do 1 or 2 rehabs on the athletes. They check in with the certified athletic trainers there, and they basically take the athlete through rehab from day 1 till return to play. And then another thing is, don't be afraid to ask the students why they're doing what they're doing. It's okay to pull in some basic science, some basic anatomy, and some basic physiology to think about why modalities, parameters are chosen, or why that athlete is doing a static stretch when we know dynamic stretching is better to warm up the body. So ideas like that work in order to get students involved. We have some new KSAs that are coming up in the future, injections, IVs, and more. At this moment, I am not going to require you to do those. We will take care of those at EKU, so I wanted to let you know that. Teach students things they haven't learned in class before. It is totally cool to have them do functional movement screenings even if they haven't done it in class, or teach Graston or some manual therapy. Most athletic trainers have one or two rehab specialties that they really like, or one or two joints that they're really interested in. Students might not get that in class. We try to cover everything, but sometimes we don't. So yeah, introduce plenty of new concepts, teach the students things they haven't learned yet. Let them come back to class and show us. That would be great. Those are excellent ways to engage students as well. I think we've covered this before. Okay, EKU's clinical policies, things you need to know. So you need to be able to see and hear the student at all times. So this is a big one, direct observation or direct supervision. So basically, if you are standing on one side of the football field and your student is across the football field, that is fine. You can see them, you can interject if there's any problem, the student can wave to you if there's a problem. You cannot send your student across campus where you cannot see them without a certified athletic trainer. The GAs at UK that work under the preceptors at the Fayette County schools and at any of the other schools count as preceptors. So as long as you can see and hear the student, or your GA can see or hear the student, that is fine. You cannot send students to drive patients to doctor's appointments. That's a no-go. If you are in the car with your student and the athlete, that's fine, but the student can't drive the student-athlete to the doctor on their own. These are our weekly hour requirements. Basically, ATR 802 and 803, 20 to 25 hours a week. Preseason practicums, which are the 3-week practicums before courses start, are 40 to 60 hours a week. And our full immersion clinical sites are 30 to 60 hours a week. The student should work with you to create a workable schedule. And in all honesty, now that it's going to be primarily master students, that should not be a problem. We pretty much have their course schedule set so they are done by at least 12:30 every day. So that's really helpful. All of our students should get 1 day off a week, and it can be any day that they get off, but it does need to be 1 day off within a 7-day time span. Now, if our students are working out at Toyota and they have Saturday and Sunday off, that will count as their days off during the week. So they don't also need a day off during the 5-day work period. We would like our students to wear name tags and uniforms. They have name tags. They all have EKU tops and khaki pants. If they do not come dressed to clinicals properly, you as a preceptor can send them home. And then that is an unexcused absence, and I would like you to please email me and let me know if there is a problem. Attendance. We're hoping attendance is not a problem, but if it is, clinical is different from the classroom a little bit. So the first time your student is absent, without prior notice, that counts as an absence. And I need you to email either myself or Dr. Sabin, or you can send a text message, something that we have in writing to indicate that the student didn't come to clinicals. The second unexcused absence without prior notice now counts as an absence. So, and then the student will meet with myself or Dr. Sabin and have a face-to-face meeting with the preceptor and try and figure out what's going on there. The consequences of poor attendance would be written and documented through the ATRAC discipline forms. Please record all the absences the students have so that we don't have to try and backtrack if there's a problem. If you have a consistently written schedule with your student, however, that is set from day one, that does alleviate a lot of the issues with attendance. So A-Track, this is the big deal here. This is where we do keep track of all of our students' hours, and this is how we know, okay? At the top of this slide, it says A-Track in royal blue, and it has a line underneath of it. If you click on that, it will actually take you to the A-Track training video, which will show you how to verify weekly hours, perform KSAs throughout the semester, and find the evaluation of the student's performance. What I would suggest with the hours is to sit down with your student and say, okay, every Saturday morning at 10 o'clock I'm going to verify your hours. What that does is it makes it so the student knows when to have all of their hours logged in by. Another thing with A-Track, it only works well on a computer. It does not work well through your phone or through your tablet. So make sure you're using your computer when you're trying to fill out A-Track. The student evaluations are on the course syllabus. So the midterm and final evaluations are on course syllabus, and it is the student's responsibility to remind you about getting these done on time. It's the student's grade. If the student reminds you on time and you don't have the time to get their evaluation done, just email me and let me know. The student will not be penalized. When you can get to the evaluation, get to the evaluation. However, if the student waits to tell you at the very last second and then you're swamped and you can't do it, then the student is at fault. But we don't penalize the students when the preceptors are completely swamped and it's the middle of the season. Our grading descriptions for students, pretty much this Likert scale is pretty severe, and it is that way in order to, have the students show improvement. So if you look at the 1 and the 2, don't be afraid to give a student a 1 or a 2 as a score, especially during a midterm. Student only performs skills when prompted by preceptor, or students performing skills only 50% of the time. You see that a lot with brand new students. They're nervous and they're worried about doing anything. They don't feel confident in their skills. What we would hope to see is from midterm to final, the student actually starts to perform skills on their own. And so by the time it's the final eval, students are up to 3s and 4s or even 5s if you think that there are certain parts of what they're doing as athletic trainers that they're ready to sit for exams, their evaluations, their professionalism, then score them with the 5. Be sure to write comments at the bottom of those midterm evaluations and make sure that both the midterm and final evaluations are reviewed with the students. The students also have to sign those. So when you are looking for the midterm assignments and the fall assignments, the seniors, they are assigned by class. So the seniors in their fall year will be an ATR 401 in the fall. In the spring, they'll be an ATR 402. The master students in the fall are ATR 802, and in the spring, ATR 803. Those are the clinical assigned classes where the checkoffs will be. You only need to pass the student. They don't have any other checkoffs, so it's just one time. And you make the decision. So make sure the student demonstrates the skill if it's a skill that can be demonstrated. Make sure they verbalize while they're demonstrating so that you know that they understand the concepts 100%. But pretty much for these checkoffs, I trust you as the preceptors. That's why you're preceptors. And so use your best judgment. If the wording on the proficiency that's written on A-Track is confusing, then call me or text me and just ask. But use your best judgment and make sure that the student knows the skill. So this is what I tell the students when I do orientation with this. I tell them, 1, set up a schedule with your preceptor and remember you get 1 day off. I tell them as the clinical coordinator, it is my job to advocate for the students, but it's also my job to work with the preceptors. So I'm the middleman. If they set up a schedule with you all, that's great, and they get 1 day off, then they can't complain about not having days off. They all need to enroll in their personal liability insurance, and they enroll in the fall, and it's good for the entire year. So they're actually not allowed to go out to their clinical sites unless they have this. We tell them to gain all they can from their clinical site and their preceptor. We ask them to be professional in their dress and their attitude. And we tell them to take risks. So here it is. You might make a mistake. That's okay. You're not going to feel 100% comfortable. But when you get out of your comfort zone, that's where the magic happens. So trying things with preceptors, now's the time to do it, because you guys are there to catch them if they fall. You're their safety net. And so we tell the students, try things, make mistakes. Your preceptors are always going to be there just in case there's any kind of an issue. So they should keep trying things. Here's some helpful tips to orient your students to your site. 1, give them the tour. Give them the grand tour. Show them where everything is. Where's the tape? How do you get out to the field? What do I do if the door's locked? Point out their OSHA. Point out their biohazard materials, cleaning supplies for tables and coolers. Tell them everything that you expect. And then, of course, your emergency action plan, which we've already talked about, so I'm not even going to talk about that again. And finally, weather. Let's talk about weather, because this is Kentucky and we all know it changes every 5 minutes. So here's the deal. The students do not come to clinicals if EKU is closed due to inclement weather. So if EKU is closed, the students don't have to go to clinicals, even if their clinical is in Fayette County or Boyle County. If the Dean of the College of Health Sciences cancels clinicals for the College of Health Science students, they do not go to clinicals. If your site is closed, if the Fayette County schools are closed due to snow, if there's a dusting of anything on the ground that closes the Boyle County schools, your students do not go to clinicals, okay? If your clinical site is closed but there is still practice, the students are welcome to volunteer to come to your site if they want to. That is totally fine with me. If they volunteer because your school is closed, they are not to track those hours on A-Track. So I have explained that to them. And I think that wraps all of this up. That's the end of this preceptor training. Congratulations, you've survived it. If you have questions, it's best to either email me or text message me. Text message me on my cell phone. As it turns off, I still really don't know how to use the phone in my office. So email or text is the best way to get in touch with me, and I will communicate back with you. Thank you so much for taking on our students. We really appreciate everything that you all do.